with regard to respiration, okay, respiratory system. So you can see the two lungs. You can see that the right lung is slightly larger than the left because there is a little cutout here, the cardiac notch, for where the heart would be. Okay? Because of that, the left lung has only two lobes that we recognize, a superior and an inferior lobe with an oblique fissure between them. The right lung has three lobes, 1, 2, and then the third one is here. So a superior, a middle, and an inferior, and then there's a horizontal fissure, and then your oblique fissure down here. Okay. If we open it up, you can kind of see that again, right? The two lobes with the fissure, the three lobes with the two fissures. Okay. Air passageways. So you have your trachea, behind it is the esophagus, and behind that is the vertebra. The trachea runs down. You can see that there's cartilaginous rings that support it and keep it open. And when it gets here to the carina, it's going to bifurcate. The first branch is known as the primary bronchi. So there's a left and a right. The primary bronchi is then going to split. Here you see 1, 2, 3, secondary bronchi. There's a secondary bronchus for each lobe, and here 2 for each lobe. Secondary bronchi are then going to split. You can see it here, so here it's secondary. Here it's splitting into tertiary bronchi. And then the tertiary bronchi will become smaller bronchi, as our book refers to it as smaller bronchi. So that would be the bronchial tree. After this point, we'll go into bronchioles. Bronchioles. All right. Here's your diaphragm. That's the muscle for breathing. Here's your inferior vena cava. This is going to be collecting blood from the liver, as we talked about in the digestive system. Here's your pulmonary veins and your pulmonary arteries. I think that's really all we need. There's your esophagus.